We just saw the video which focused on the group of sustainable development goals which are centered on improving the well-being. It also highlighted the way accreditation supports in meeting the needs of people as it verifies that products are safe and quality expectations are met. Which also brings us to the theme of this session, that is accreditation supporting good health and well-being. SDG 3 focuses on ensuring healthy lives and promoting well-being for all at all ages. It focuses on reproductive, maternal, and child health to communicable and non-communicable and environmental diseases. It advocates access for all to safe, effective, quality, and affordable medicines and vaccines. Use of accreditation within the healthcare sector can help us drive up the quality and consistency of the services provided. To get more light on the subject, we have our esteemed dignitaries who will be further lighting us on the theme. Now, I take the privilege to invite the chairman of the session, Mr. Deep Kapuria, Chairman NABCB, for his introductory remarks. Prior to that, let me briefly introduce him. Mr. Deep Kapuria is chairman of High-Tech Group of Companies. He is also the chairman of Global Innovation and Technical Alliance, a company promoted jointly by the Technological Development Board, Department of Science and Technology, Government of India, and CII. Over the last 2 decades, Mr. Kapuria has held eminent position in the industry association, and government bodies. He had the privilege to lead the industry to support the policymakers at trade talks at various WTO ministerial and bilateral trade negotiations. Recently has been the co-chair for the Task Force on Digital Economy and Industry 4.0 at B20 Argentina. He has also been a non-governmental member on various government committees, including Make in India, Skill Council, MSME Ministry Task Force, Ease of Doing Business, High-Level Committee on National Manufacturing Policy, etc. Currently, Mr. Kapuria is the chairman of CII National Committee on Design and co-chair of CII National Council on International Trade and Policy and the chairman of CII Regional Committee on Central Europe. Mr. Kapuria has studied from Mayo College, Ajmer and graduated in engineering from BITS Pilani. He is an alumnus of Harvard Business School, USA. I welcome you, sir. May I now request you for the introductory remarks.
Thank you. Distinguished guests, panelists, ladies and gentlemen, very good morning. I have the privilege to welcome you all to this virtual session being held to mark the World Accreditation Day. The global initiative established by IAF and ILAC to promote the value of accreditation. We have a very eminent panel with us today who shall highlight us and shed light on various facets of the subject. Before I ask them to address you, let me paint a contextual landscape with a broad brush strokes of the theme of the year, accreditation, supporting the implementation of Sustainable Development Goals, the SDGs. In this session, we would focus on the third goal of SDGs to ensure healthy lives and promote well-being for all at all ages. This theme could not have been more appropriately timed. We are all aware of the world that we are going through a very, very grim phase in health crisis. We in India have hopefully seen the tail end of the second wave of the pandemic, which brutally exposed our vulnerabilities as a society. And hopefully, as Dr. Shetty said, we would possibly see the third wave just as a common cold entity. It's true that the very best of healthcare infrastructure could not have adequately taken care of the sudden and exponential rise of the infection in the second wave. The hospitals, the healthcare facilities, including the labs, were just overwhelmed with the flood of COVID-19 patients. It also impacted other patients with acute and chronic ailments with even the basic and standard care. For a moment, if we were to just consider the pre-pandemic time frame, India definitely has made significant strides in improving the various healthcare indicators. Of course, the challenges of primary and secondary healthcare still need address at a very basic level. The concerns which we can talk about are weak healthcare infrastructure, shortage of qualified human resource, inefficient delivery of healthcare services, especially to the poor and the downtrodden. To top it all, in this issue of very unethical practices rampant, especially in the rural and the semi-urban areas. All this, of course, requires focused attention and monitoring, besides making the regulatory and enforcement system more robust and effective. The situation we faced in the country since the pandemic last year is a testimonial to some of these issues that I stated. SDG 3, which is a rather ambitious program, provides specific goals and kind of a framework that could inspire the healthcare system to attain wellness for one and all. Definitely, we as a country are committed to the sustainable goals and the universal healthcare coverage by 2030. The National Health Policy of 2017 spells out these goals to attain the highest possible level of good health and well-being for all. The flagship programs such as Ayushman Bharat are an outcome of it. Recently, NITI Aayog published SDG India Index and a dashboard for 2021, a report mapping the performance of various SDG parameters. The report even assigned ranks to various states to encourage better compliance through healthy federal competitiveness. However, if we look at the healthcare, today and every day, lives of a vast number of people lie in the hands of the healthcare system. Right from combating disease, epidemics, and pandemics like the current one, it also has to strive to reduce basic goals of infant and maternal mortality, take care of the frail and elderly, and also provide healthcare which is vital to the responsibility and continually keep supporting the well-being of one and all throughout their lifespan. We all know it's kind of an imperative for healthy development of individuals, families, societies, which form the very foundation of a progressive nation. But healthcare institutions have very little, could have only very little impact in providing services unless the healthcare systems are strengthened both qualitatively and quantitatively. Quality infrastructure institutions such as metrology, standardization, conformity assessment, and market surveillance, along with accreditation entities, are critical enabling cornerstones for delivering life-enhancing interventions. So, if we were to ask, what makes a good healthcare system? What makes a healthcare system fair? And how do we know whether the healthcare system is performing as well as it could or it should? Quality-enabled accreditation, which provides the technical foundation of the healthcare ecosystem, provides parts, but not in, however, a very, very essential answer to these questions. Health and social excellence is driven by the need to provide confidence in the delivery of competent services to patients, families, regulators, and citizens at large. Accreditation within the healthcare and the social sector also supports quality assurance. It also provides an essential tool for the healthcare providers to demonstrate that they have undergone a rigorous process to ensure that their patients consistently receive quality services delivered by competent staff working in a safe environment. I think we'll all agree that the healthcare facilities and medical laboratories play a very important role in evaluation of human health status and provide correct diagnostics, treatment, and prognosis for the diseases. So the quality and technical level of healthcare facilities and medical laboratories are directly related to the health and well-being of the citizen at large. The primary purpose of health and social care accreditation is to improve the process and the environment to ensure that the user of the services receives consistent high level of care. UCI, and much of it was also talked about by Adil, and its various arms have been contributing immensely to the healthcare system as an enabler for the nation to achieve the objectives of SDG 3. The list is very exhaustive. Some of it, like I said, was talked about by the chair, Adil. So let me give you just a snapshot of the potential and contribution of UCI and its entities, which are like this. Notified by the Central Drug Standard Control Organization, NABCB provides accreditation to certification bodies which certify medical devices and their quality management system. NABCB also a signatory to the mutual recognition arrangement with ILAC for inspection. Thus, these certificates and accreditations are internationally equivalent and acceptable. NABL too has a similar agreement. Thus, it provides internationally accepted assessments and accreditation to medical laboratories using international standards. NABL has accredited more than 2,000 medical laboratories, some of them which came about very recently. However, on the other end, there is no consolidated figure of medical laboratories that exist in India. The rough estimate could be about 100,000, which means most of the small medical testing laboratories operating in India are without any certification or accreditation. This obviously puts a lot of patients at risk, specifically in the rural areas. To address this challenge, NABL has launched a voluntary scheme, namely NABL Medical Entry-Level Testing Lab Program last year. This scheme sensitizes the medical testing laboratories to the basic quality practices. It helps majority of citizens, especially those residing in villages, small towns, and semi-urban areas, to access quality healthcare at low costs. However, a little over 100 medical labs only have come forward to take benefit of this scheme. It's noteworthy that the promptness with which NABL stepped up, and I'm not going to repeat what Adil said, in helping out with RT-PCR tests and helping various accreditations for testing labs of PPE kits, etc. NABH operates various accreditation, certification, and empanelment programs which empanel nearly 3,200 institutes across nations and has accredited nearly 95% of the hospitals and healthcare organizations which are more than 50 beds, which number around 1,200. NABHB accreditation also correlates to the SDG 3 goals and is recognized internationally at par with global healthcare accreditation standard, and is definitely doing the society a great service. This was, as I said, just a glimpse of the contribution of UCI and its entities to enable and strengthen the healthcare infrastructure of the country. It's evident that the large and more holistic approach to good health well-being will be required for the healthcare facilities, products, services if we are to aspire to be amongst the best globally. Accreditation shall and always will play an important role to support and achieve the goals of SDG 3 with adoption of harmonized global best practices. NABCB and NABL, together with QCI, are committed to provide support to all the key stakeholders of good health, well-being, and the citizens at large of the country. Thank you.
Thank you, sir. Thank you for highlighting the importance of accreditation in the healthcare sector and also setting up the tone for the session. So with your due permission, can we have the group photograph first?
Sure,
I would request all the dignitaries to smile for the camera for the group photograph. Sunil, kindly take the group photograph.
Okay.
Done.
Thank you. Before we proceed further, I would request all the attendees to post their question in the chat box appearing on the right side of their screen. We'll try to take up the question answer in the end of the session if the time permits, even though we are running behind the schedule. I would also request our dignitaries to restrict their presentation to 7 minutes so that we can complete the session on time. Now I take the pleasure to invite the first speaker of the session, Dr. Jitendra Sharma. Dr. Jitendra Sharma is the Managing Director and Founder CEO of Andhra Pradesh MedTech Zone, which is the Asia's first medical device manufacturing park. He is the Founder Executive Director of Kalam Institute of Health Technology that serves as a medical technological policy institute to various departments and Ministry of Government of India. He is the Member Secretary of National Medical Device Promotion Council and Founder Chairman of two MedTech incubators, MediValley and BioValley. Dr. Sharma has been awarded the Europe Union India Young Leaders Award at EU Parliament, Brussels, and AMMI